So you all probably heard that. The meeting is going to be recorded so that we can post it later on our website. We did have a lot of folks who were interested who weren't able to join us today. So we think that will be a good community service to make it available later. So with that, I'm going to go ahead and get started as folks continue to join us. My name is Libby Avert. I'm the president and CEO of United Way of the Coastal Bend, and we are so honored to be able to sponsor and facilitate this discussion today. A few just housekeeping measures, if you will. Maybe if I can get there. Oh, there we go. A few housekeeping items for today. As I mentioned, the webinar is being recorded, will be available later on our website. Those of you who are registered participants, we can also email you a link to the slides. And as I mentioned, questions can be submitted via the chat. And today's panel discussion is not meant to be the end-all be-all to all of the difficulties that we may experience related to grief, but hopefully it will be a beginning of a conversation, a beginning of some of your own self-reflection and thoughts about what you may need to do to help yourself if you are dealing with some sort of loss. And before I get into some statistics about what we have experienced collectively as a community, I want to tell you just a little bit about our presenters today. We have Dr. Nelly Garcia Blow, who is a doctor of osteopathic medicine. She is board certified in family medicine and geriatrics. She provides local geriatric consults for older injured patients at CHRISTUS Spohn's Level 2 Trauma Center. After attending medical school at the University of North Texas Health Science Center, Texas College of Osteopathic Medicine, she completed her family medicine residency and geriatric fellowship at CHRISTUS Spohn Hospital Memorial. I've known Nelly for a few years now and have heard her on several presentations. I think you're going to really appreciate what she has to say. I'm also blessed to know Kristi Phillips, who has a master's degree in family therapy and has been a licensed marriage and family therapist for 17 years. She has specialized training working with children who have experienced trauma, anxiety, and depression, as well as specialized training in therapy with families and couples. Kristi has worked at Family Counseling Service for 9 years and currently serves as its executive director. And I am a big fan of Family Counseling Service. The United Way has had a relationship with them for many, many years. And am just so grateful that Kristi, you're with us today, and also Dr. Blow. We needed some experts here who could help us with this conversation. Before I turn it over to Dr. Blow first, I want to share with you all some statistics. I'm not going to read all of these to you, but I thought this was a good sort of grounding point for why we wanted to do this. Now, these COVID numbers are not up to date. I think I pulled them last week, so it's more than that. But we wanted to make it very clear that this discussion is not just about people who have lost loved ones due to COVID. We know that, since last March, all of our lives changed in some way. We certainly lost some social interactions. Many people lost jobs. Certainly more than 800 families in our community lost people to death. But there are also other deaths that happened during this time period, and some increases, as you can see here, from drug overdoses that were up, and just overall, the death rate being increased from prior years. But then, as I mentioned, there were other losses, loss of jobs. Obviously many of you on this call probably had to school your children at home while you were trying to take care of other responsibilities. Many of us had to work from home in isolation. And it was just a year where I think all of us had some level of mental health issues, depending on what we had to deal with during this incredible pandemic. So, this discussion on grief could probably go on for a couple of weeks, but we're just going to devote, about an hour and a half or so to it. And as I said, hopefully this will just kind of be the beginning of a conversation for some of you and give you some resources where you can turn for some additional help. And with that, I'm going to open it up for Dr. Blow. and turn it over to her. And feel free to go ahead and put some questions in the chat, and we will get to those periodically. So Nelly, take it away.
Thank you, and good morning to everyone. Thank you for taking some time today to have a conversation with us, listen, hopefully learn together. Every time I do one of these presentations, I feel that I learn as much as hopefully I give to you today. I think whenever we talk about any conversation, and especially something like grief, I think that the main thing is opening up the conversation, opening up the dialogue, and recognizing that there is no normal and that everyone will be different. And so we have to be, I think, much more graceful in how we treat each other, how we treat as physicians, how we treat our patients, and our expectations of each other of what this process will look like. And so I want to go over a little bit about grief. What is it? What are some of the definitions, the words that we use? What are some physical impacts that you have? I feel sometimes when we get into the behavioral health space, sometimes people don't think it's as real as it is. And so I always like to bring in the physical impact that it has on your body, that we've studied, that we know there's physiological changes. And so we know it's a medical condition. And so I think when we understand it better from that standpoint, we can hopefully appreciate it, and we can learn from it, and we can figure out, just like any other disease, we think about treatment and how do we do that treatment. And so hopefully we can talk a little bit about that today. And I'll go through it. I love questions. I love interactions. I don't like to hear myself talk for too long. So hopefully we can just go over that. We can get a lot of questions, and we can make sure we address grief from what you believe would be the best way to learn about grief. And so as Libby said and pointed out, and it was something that I didn't think about really until we started getting into this conversation of what this panel and this day today of real talk would be. And so grief is not just loss. Doing geriatric trauma, I obviously deal with a lot of death and sort of morbidity every single day. And so a lot of the times for me, when I think about grief, it's due to medical issues, and it's due to complications, due to trauma. And the truth is, grief can be from a number of reasons that you have grief. And I think the main thing during this pandemic that we've seen is a cumulative grief. And so maybe you were experiencing some stress because you're, homeschooling, which we all went through together. And so, and with that, jobs and changes in income, and then maybe a death in your family, and not being able to maybe grieve that death the same way you would surrounded with family and friends. I can share, I'm a big sharer of personal because I feel that it connects you. And so last July, in the peak of COVID, we lost my sister with Down syndrome, questionable whether it was COVID or not. She had a fever, and 3 days later she had passed. And it was very quick. And as I was at 3 a.m, getting in the shower and trying to get down to my family who lives out of town, my husband looks at me and says, "How are you going to go into a house where there's fevers? We have a daughter, I have patients." And so I wasn't able to go home. And that was the most logical thing to not make a situation worse. And all the while having my mother, who's 70, trying to tell her, "What do you mean everybody's at the house? What do you, and all the siblings are 70. And so it was just a very difficult way to deal with a loss. And so you really get that reality of what COVID has done. And so when we talk about grief, it could be a death because of COVID and all of that, but it's also everything else with it. As we look at grief, we think about different types of grief. So the obvious, when someone passes, when you deal with a loss of any kind, you have that bereavement and that loss, and then you have the grief. And those are the feelings that I think oftentimes we know about: that sadness, the loneliness, maybe that change in appetite, maybe that change in wanting to do any activities. And so those are the things you deal with grief. One of the things that I find in healthcare that we don't talk about enough is anticipatory grief, which means you're anticipating that loss of someone. And sometimes when you have someone and you're a caretaker, which obviously I chose geriatrics quite a few years ago. And so I wanted to be a geriatrician probably in the 1990s. Uh, and so now as the population is aging, many of us find ourselves being caretakers of people with chronic illnesses for an extended period of time. And it's multi-generational, right? So you might be taking care of your kids and you're having to also take care of your parents who are dealing with, and you might even be dealing with a spouse with medical problems. And so you're kind of in the middle of dealing with a lot of, I think, impact into your regular life. And so you have this anticipatory grief. What is life going to be like when that person's gone? What is that going to feel like? How, maybe a financial stress associated with that. And so I think that anticipatory grief is something that I know I talk about every day with my patients and their families, because I always tell my patients and families, this is a marathon. This isn't going to be over in 2 weeks. You're not going to be able to move on or get back to normal, quote unquote, normal. I don't like the word normal, but normal life. And so you're dealing with this grief, and it layers on itself. And so I don't think we get the help we need during that time to be able to talk and be open about that feeling of overwhelmness, because you want to make sure you're strong and you're being a supportive person for that person that's going through those medical issues or other issues. And so that anticipatory grief is very important. One of the things we often talk about, and what I always like to say, is all of this is normal. Bereavement is normal, grief is normal, anticipatory grief is normal, and having these feelings is normal. And then you get to complicated grief. And so complicated grief, oftentimes when you go see your doctor, they'll talk about this taking almost too long to heal, right? We expect people to have that acute phase. We expect people to improve, but you're always going to carry that with you. And Libby said that the other day, and I thought that was so powerful. You never get over grief. It becomes a part of you. It's something you deal with and you just learn to live with. And so what I always look at is, how is it affecting your normal day-to-day life? It's kind of like pain. You know, pain will never go away. And so, but are you able to do your activities of daily living, and then you continue to grow from it? You continue to get better. We don't want you to stay stagnant at that place. We want to come up with different ways. But that's that complicated grief that gets in the way of your activities of daily living, that gets in the way of you eating, that gets in the way of you maybe going to work, having those social interactions. And it's a prolonged period of time where this happens. There are some risk factors that we can look at. And all of this is, I find that there's some things in medical school, there's so much to cover. And so I find that nutrition has not been something that's been covered in medical schools in the United States. And so we're learning that now. And I think this issue about death and dying is not covered well. And so you might go to your physician and they might not quite deal with the way that you say. And so you might have to find other resources. And I do think that's important. I do think it's important to make, and we'll talk about the treatment, and we'll talk about things maybe that can help you get through that grief. And I always think being able to make an appointment in a month, in 2 months, in 3 months, to just say, it's just an appointment to talk about this. I'm not going to talk about my high blood pressure. I'm not going to talk about my diabetes. I don't want to talk about my weight. I want to talk about this one thing. And that can help you, and all of us who have gone through grief, that can help you with the concept of one foot in front of the other. And I think your physician could be very important in that. And of course, I'm a big believer in counseling in that. And so when you hit the complicated grief and you're needing those extra resources, being able to have someone that can look at your schedule, that can look at what your life is looking like, and can be an outsider looking in, I think is so important. Because when you're going through grief, I think those days get lost, and they kind of, one day gets on top of another, and then before you know it, it's been 3 months, and you're just not getting back to those normal activities that you were doing before. And one of the things that I find obviously in geriatrics is that a lot of the times your partner is the one you were doing these things with. And so all of a sudden your social interactions, well, that was the person you were having your social interactions with. And so I think sometimes us, and I can say me as a physician, I sometimes don't look at that as, it's not as easy to get back into your normal routine when your normal routine was with your spouse, with your, that individual that you lost. And so I think sometimes that's also something that we deal with. And so as we talk about the physical impact, one of the things that I'm always, just shocked by, right? We know, and any of us who have gone through significant grief know, those first couple of weeks you get sick, you maybe get a cold. It feels like you always end up sick. I don't know if this happens to everybody else, but you go to a funeral and you're sick. And so a lot of that is explained. We know that our immune system revs up. We know that there's a significant release of stress hormones. We know that your heart rate goes up, your blood pressure goes up, and you even have an increased clotting in your blood. And so increased risk. So if you already have comorbidities like high blood pressure, diabetes, or obesity or anything, this only magnifies that. And if you don't have that, it also increases your risk. One of the things as I was reviewing for this panel that I was shocked to hear is that in the first day when you experience a big grief, your risk of a heart attack is 21 times higher than it was the day before. 21 times higher. I mean, I was just shocked. And up into that week, it's still 8 times higher. And it takes about a month for you to get back to that normal physiologic state. And so it clearly causes a significant physical, I think that explains all of those feelings that you're having and all of that. So we know in those months, we know there's a higher utilization of medical resources. We know there's more illness. We know that it can exacerbate comorbidities. And then a lot of us, over the years, I'm sure on the news and things like that, you might have heard about broken heart syndrome. And so that's something that is a real phenomenon that we do see. And thankfully, we don't see it that often, which is wonderful that our body is resilient. So I don't tell you these things to scare you and make you nervous for your loved ones or this, but it's just a reality of how your body is having a tremendous physical impact during this time, this acute phase of grief. And so it gets us to the conversation on diet and exercise. So making sure that you make healthier choices during that time is super important. Making sure you rest, making sure you exercise. And one of the things that I find most often is the importance of being able to find that routine during that anticipatory grief. And it might be because of what I do, that a lot of it is chronic illness and caretaker, that are dealing with this. But I think as much as you can put that in your daily life, and I'm not the healthiest person out there, so I understand that this is a challenge, but I think this is so important at being able to get you through that grief in the best way possible, because you're still going to be dealing with everything else. What I always tell my patients is it's very difficult to deal with your sugars in the 400s and the grief that you're dealing with. And so those of us, with comorbidities, recognize that you're dealing with 2, 3, 4 things at the same time, which is very, very challenging. And so trying to get back to that normal routine is so important. And part of that is using friends, finding resources. We know that those risk factors that put you at risk, socioeconomic status, not having a good infrastructure. And what I find, obviously, doing this is sometimes you have to look outside your family. Sometimes it's not within your family unit that you will find the most support during this time. This has happened in our own family where sometimes it's like, well, they should really get over it and they really need to move on, or you need to have more faith in God's plan, or whatever the unintended consequences of those statements. But sometimes it's not in the family that you will find the most support. And so making sure you look at, there are some situations that we know put us at higher risk, usually a spouse, a loved one, that tends to be, and I think because of the social interactions and that being your inner circle, so to speak, I think that makes a difference. And I also, the big one that we see is the loss of a child. The loss of a child definitely puts you at a very, very high risk. And interestingly enough, even though all the moms on the phone call would agree, it tends to affect a mom more than it does the father. And so those are people that we know will have an increase just off the top. And it doesn't mean you immediately go into therapy. It just means that we work and emphasize the importance of all those things we talked about to make sure that you have the best possible chance at going back to your normal routine, because that's always the goal. It's about going back to that normal routine. putting one foot in front of the other and then finding that new balance of what that life looks like. And so the other thing we always talk about is avoiding alcohol, avoiding drugs. Alcohol is a depressant. And so we always have to be very conscientious of that. I think the more we can have those open conversations as physicians, we need to be able to have these conversations with our patients and being able to say it's okay. And we need to be able to talk about it openly and honestly, that this is a real issue that we deal with and we all deal with it. I always, the reason why I share so much and always share personal, because I think it's important to say that we all go through this. You're not, you know, I always tell my patients, you're not special in this sense. You're very special in a lot of ways, but we all deal with grief. We all deal with looking at exercise and diet and substance use. And it's just in different ways that we do that. But I think it's important to say we all deal with it. And so, of course, I always have to end and make a comment on code status because of what I do every single day. I think it's so important to have these conversations. And one of the things you'll know about me, and my mom was like this from when we were growing up, you talked all the time and talked. And so I always think it's important to have conversations about what do I do in the event and what are my wishes? And I think it's important to hear the voice of the individual sharing those wishes, because I can tell you in the hospital, when the family is trying to decide what those wishes are, it's much, much more difficult. And I personally believe that the grief is complicated further when you feel like you're making that decision that you're not quite positive was in line with that individual's wishes. Because it's not, I always say this, right? We want to have our parents, grandparents forever. My grandmother lived with me until she was almost 101. And so we want that, but we also have to be making sure, I think, that we're understanding of the individual's wishes. And so that's really, really important. So I think as much as you can have these conversations, I'm a big proponent for writing it down, because then it's easier for the family. It takes it away. I think it takes it away, that added responsibility that you made some kind of active decision. And so I personally feel that it makes it much more passive. You're just going along. The wishes are well documented. It's been discussed. You'll never get, if you have a big family like mine, you'll never get everybody on the same page. And so it's better to have all these discussions ahead of time if you can. And so hopefully you'll go home today. I always tell our families, I scare everybody's eyes open, because every room I visit, I talk about code status. And they could be in there with a broken great toe and they're going, why are you talking to me about this? And so I always think every opportunity that you can have to say, let's just have the conversation. Let's share, what does this look like? And I think that it, especially in the context of grief, is so important, because it's something that you won't have to deal with in the acute phase of everything. And so I think that that would really be beneficial if we did that more. And so if anybody has an iPhone, the other thing I always say is there's a medical ID on your iPhone. And I always like to talk about it, because you come to the hospital, we don't know your blood type, we don't know what medicines you're on. And so even if your phone is locked, you can click a button on your iPhone and we can know your medication, your medical history, any allergies you may have. If you know your blood type, you can put it in there. And so anytime I have a form, even if I'm talking about something completely unrelated, I always like to mention that, because I think it's so important that we try to do all we can. But thank you so much for the opportunity to spend time with you. I'm looking forward to hearing everybody talk, and I hope there's questions and we can elaborate further. Thank you.
Thank you so much, Nelly. I do have a question that I'm going to go ahead and ask here, and then if somebody has a specific for Dr. Blow, you can put it in the chat. But I was going to ask, for those of us who did have to grieve during the pandemic, I mean, luckily we're at a point now where more people are vaccinated and get out a little bit more, but can you talk a little bit about the difficulties in grieving isolation? And how we can get through that?
I think the best advice I could give anybody is to almost start from day zero, because I do think that's what we're seeing. I think that we're seeing people that, even though it's been a year, and so typically you would say, well, this is complicated grief, or this has gone on, you would expect it better now. I don't think that's the case, and that hasn't been my experience. I'm finding people behaving and talking about the death as if it just happened yesterday, because my belief and our feeling, and there's nothing written on this, there's no manual, there's nothing to help us as medical providers, and there's nothing, we can continue that conversation, but I think what we have to do is normalize it. I think we have to say, it's okay, we're just, I know for me personally, I hugged my mom for the first time last month after we had experienced that death in our family. And so she went a whole year without having that from us. And so as her other children. And so I think that you almost have to treat it as it's day zero, and then go through and make sure that there's not something there. And I'm sure Kristi will talk about it because she's dealt with it a lot from the counseling side of it. But I think that we're going to see people hopefully reaching and going out, for resources to make sure that we talk about it and we give people an opportunity to heal from it. Because I think because there was so much isolation, and what gets you through it is really those conversations and working through those emotions, I think we're going to have to open it up and start as if it's day zero.
Great, thank you. Thank you, Dr. Blow. I'm sure we will have some more questions toward the end. With that, I'm going to turn it over to Kristi Phillips, the Executive Director at Family Counseling Services.
Good morning, everybody. Thank you, Dr. Blow. It was all really great information, and I'll probably expand on some of the things that you touched on and be adding to it as well. So I'm glad everybody was able to log in this morning, and hopefully we'll be able to continue the conversation and get you thinking about some things a little bit differently as well. Dr. Blow talked about a lot of these things. We experience grief in response to various kinds of losses. The most obvious one that we usually think about is death of friends or family. But during the pandemic, we experienced all of these different kinds of losses. Losses, maybe not complete loss in relationship, but changes in the way we interact with those relationships, and a loss of feeling connected to other people. Most definitely a loss of routine. I mean, how disorienting was it for all of us to have to work remotely, try to be there for our kids in their schoolwork, even dealing with job loss, all of those kinds of things. It's part of that loss and grieving process as well. And it can be kind of confusing, right? Because we feel kind of disoriented and something's kind of off, but we maybe as it was happening didn't really quite understand it. Like, why do I feel so out of whack? And it's because there was a loss of all of those things that we considered to be normal. And so the loss of experiencing milestone events, I think about that for so many of our high school students, our college graduates. They couldn't go to prom, they couldn't experience graduation in the ways that they normally would. All of those kinds of experiences were either they weren't able to participate them at all, or they weren't able to participate them in the way that they had always envisioned, which is a significant part of the grief process as well. When something happens in a manner that we that's outside of what we always expected or envisioned to happen. Weddings didn't happen the way that we wanted them to. They became really, really small, or, maybe in some ways didn't happen with friends and families at all. There's grieving that happens with all of those kinds of things. And of course, changes in our own health and health of loved ones. That's part of that anticipatory grief that Dr. Blow spoke about. And a loss of overall sense of well-being. I think many of us probably just kind of went through everyday life before the pandemic and didn't really give too much of a second thought about whether or not we could get sick or any of those kinds of things. And then all of a sudden it was like, I don't know if I can go to HEB and still be okay. I mean, that is a huge, significant change. And so that's difficult because there's a sense of uncertainty, you know, that we wouldn't necessarily think about having grieving response to, but it was extended, right? And it went on for way longer than I think any of us thought was going to happen. So it's kind of those things that sneak up on us in those kinds of ways. And Dr. Blow talked about multiple different kinds of grief. And so one thing I would add to that is ambiguous loss. You probably, you know, some of you have probably heard about ambiguous loss, but it's this sense of when something happens and there's loss without an explanation or without any clear understanding of exactly why something happened or how it happened. And so it's most of what we experienced during the pandemic, it was an ambiguous loss. Even when there was the death of a loved one, trying to understand whether or not it was COVID, you know, exactly what happened, because for so many people, those deaths happened very, very quickly. And trying to wrap, you know, your brain around those things can be really difficult. Libby, you can go ahead and go to the next slide. So grief helps us to recognize that we've experienced a loss that we need to adapt to. We've experienced a loss and that we need to adapt. And so in that way, we can think of grief kind of as serving a purpose, right? Our bodies and our minds are telling us we need to adapt. And there's this whole list of things here on the screen that you guys can probably all read through that encompass mental signs, emotional signs, cognitive issues, physical issues. All of these things are what happen not just during grief of a death, but in any kind of loss that we experience. I think most of the ones that are listed here at the beginning, stress, sadness, irritability, those are things that we typically think of, but also, you know, being preoccupied, easily distracted, having trouble focusing, problems with memory, getting stuck in our negative thoughts. All of those things are things we might not necessarily think about when it comes to grief. And of course, sleep issues, sleeping too much or too little, a decrease in appetite or an increase in appetite. Engaging in risky behavior is something that we often see. Sometimes that is something people use kind of as a way to cope with their grief and their difficult feelings. So risky behavior can look like things like drugs and alcohol, but even spending too much money, you know, making poor financial decisions, making life-changing decisions without really thinking through all the implications of those things. And then, of course, there's all the physical symptoms that Dr. Blow mentioned as well. So I won't go through all of those all over again. Let's see. The grief process is different for every individual. And so really the theme of this is patience with yourself and others. I'm not sure if it was Dr. Blow or Libby, but one of you talked about the need for being gracious with ourselves and others through this process. And that's another really great way to think about it. We talk about how, or I don't know if you guys remember, for months and months and months, we heard, we're all in this together. And, you know, Libby's laughing. So, and it was kind of like, yeah, we are. And then at some point I was like, oh, I'm so tired of hearing about that. But it's true, we were all going through something, but the ways in which we were experiencing it were very, very different based on, you know, how the level of the impact that the pandemic had on us, whether or not we lost a loved one, whether or not we lost a job, whether or not we had to quit a job to stay home with kids and make sure that they were getting their school work taken care of. So even though, yes, we were all in it together, our responses are so different. So in terms of thinking about being patient with ourselves and others, it really means don't compare your own process to other people, because your experience was unique and individual. And you get caught up in the, well, so-and-so is doing so much better than I am, and I'm stuck. That's not helpful at all. You have to be able to honor your own experience, acknowledge that, and understand that the reasons behind all of those things are very, very individual. Same thing with others, being patient with other people. And, it's easy to kind of get frustrated with people we care about when they're stuck because we want them to feel better. But being gracious and patient with other people's grieving process is also very, very important.
Kristi, I'm going to interrupt you real quick with a question from one of the attendees, which I think is a great question. And that is, how do you talk to older children, teenagers in particular, if they won't even acknowledge that what they're experiencing is grief?
Well, I think it's important to not think about talking, but think about listening. Which I also get probably the follow-up to that is, but what if my teenager's a teenager and they don't talk to me? How am I supposed to listen? And so really it's about providing an open door, checking in with them, saying to them, how are you doing today? I've noticed you haven't come out of your room very much. If there's ever anything you want to talk about, I'm here and I'm ready to listen. So we've opened up that door to our kids, especially teenagers. And hopefully we choose at some point we hope at some point they will choose to walk through that door that we've opened, and that we will be ready to listen and to validate what their experiences are. So rather than trying to convince them that they need, to acknowledge that grief, just to be able to be there. And sometimes maybe it means just sitting with them in their room and not talking about anything, especially for teenagers. I know that's complicated. But being willing to share your own feelings, is a part of that. It's sort of, as parents, we try to model those things for our kids. And so it's okay to become emotional, and express your sadness and say, gosh, you know what, today would have been grandma's birthday. It's kind of a sad day for me. And then finding the balance to make sure that you're not, burdening them and with your emotions, right? To be able to say and acknowledge, I'm having a hard day today and it's kind of a sad day. How are you feeling? Without making them feel like they're responsible for making you feel better. That can be a really tricky balance. And sometimes that's a really good sign that therapy can help, right? In those situations, because a counselor can kind of help a family navigate through finding that balance. That was a long answer, sorry.
That was great, thank you.
Okay, so let's see. Oh, actually, I think before I start talking about how I can help myself, how we can help ourselves, I wanted to talk a little bit about, and I don't have a specific slide for this, Libby, about how grief and loss can really complicate relationships and families, which we just, alluded to. Because emotions are intense and they are high. And especially after the death of a loved one, there are so many decisions that need to be made and business that has to be taken care of that if relationships were already kind of tense, conflict can become, even more intense during those times. And so, as much as possible, going back to being patient, with each other and understanding that everybody is dealing with something in their own way during those times. And if there aren't any big decisions that have to be made immediately, then, try to put those things off until, people in the family have had a chance to try to sort things through emotionally for themselves. In the case of ambiguous loss, that most of us has experienced during the panel, it can be even more confusing to kind of understand what it's like for everybody in the family, because it's ambiguous. It's vague. What's causing our sense of loss is a vague kind of thing that sometimes we can't always put our thumb on. And so going back to the importance of listening, and not expecting somebody else's experience to be the same as ours. And when somebody's expressing, some frustration or feelings, to just be with those feelings, which we'll talk a little bit more about later as well. So how can you help yourself? Self-reflection is a really important thing, and people, find that in many different ways. Journaling works really well for a lot of people for self-reflection. I always joke that I'm a therapist and I don't journal. It's not my thing, right? And so you have to figure out what works for you. For some people, it's prayer, it's meditation, it's going for walks, being in nature. But finding a space where you can kind of understand your own tendencies. Are you a stuffer? You have to kind of know, are you somebody who typically holds things all on the inside and stuffs your feelings? Or are you the opposite, where you wear your feelings on your sleeve? And so when you know what those tendencies are, then you kind of know, where you might need to make some sort of modifications. If I'm a stuffer, then I have to be very intentional about finding ways to talk to other people about what I'm feeling, and choosing those people who are trusting and are emotionally supportive of me, so that I can continue to do that in a way that's safe. And if I am somebody who wears my feelings on my sleeve all the time, I might need to do the opposite. Instead of telling every single person around me how I'm feeling, right? Really, again, finding those few people in your life who you really trust, and talking to them about it, and finding that balance, again, can be really difficult. And so sometimes getting, again, counseling to help sort through what that looks like for you can be very, very important. Avoid isolation, which, gosh, we were all isolated. So that's so hard. We really had to be, and in some cases still have to be, very intentional about what that really means for us right now, where it means like reaching out, by actually dialing a phone number, right, and talking to somebody. That Zoom had been a really great thing for a lot of families to keep in touch. I know that we started like an every other Sunday Zoom meeting with our families who, were all over the place. And that was a great way for us to keep in touch, because my parents loved to go visit all the grandkids. They would, go visit grandkids here in one town and go, out of state to visit the rest of the set of grandkids, and couldn't do that. So we got together on a 30-minute Zoom call every other week. And there are definitely some families who are still in that kind of situation, based on what their level of comfort is with the pandemic right now. The next thing is know when to set boundaries. And what that means is sometimes we maybe get flooded with support after a loss in a way that's overwhelming. And so sometimes that actually means the opposite of what I talked about with reaching out, but knowing when it's too much, and to say, no, it's okay. I don't need you to bring dinner tonight. I'm good. If you are more of an introvert, having those times where you're sort of alone and with yourself can be really an opportunity to recharge. And so setting boundaries when needed, and also telling people who maybe have really good intentions of being helpful, but their actions are not actually very helpful to you, telling them no, like, no, I don't really need you to come over right now because I'm good, or I don't need to take this phone call right now, because maybe that person who has really good intentions, for example, might get on the phone and just talk about their own struggles, and then you feel burdened with their struggles. And so sometimes we need to set those boundaries as well. Look for the things and the activities and people that bring you joy and a sense of calm. Again, something that's very, very individual. Sometimes it's physical activities, sometimes it's spiritual activity, sometimes it's just having coffee with your best friend. But look for those things and be intentional about ways to work them into your life. If you're not intentional during these times about working those things into your life, it's not very likely that we're going to be able to follow through with those things. As Dr. Blow talked about, take care of your physical health. And then it's okay to let go of the idea of getting closure. I think that is something that society has done a disservice to us in general, this idea of closure. What does that even mean? Anybody who's ever experienced a significant loss, death of a loved one, understands that that's something that we don't really attain. And it's okay to accept that. Our emotions don't go away, but we learn to manage them. We learn to integrate our loss in order to move on. And I think integrating is maybe another word for what we typically talk about as acceptance. But integrating really means that we continue to work on ourselves and grow as people. While the loss is there because we never stop loving our loved ones. So that sense of loss stays, but we learn how to manage it and hopefully have a growth process where it's integrated into what we do. Okay, Libby, you can go to the next one. Okay. When do you know you should seek help? Dr. Blow also talked about this. How is your functioning, been affected? There's really no like set timeline for, okay, if you've felt this way for a certain period of time, then it's time to call for help. It's really about that self-reflection and understanding what is the significance of how your functioning is being affected. If your physical health is declining, then definitely that's some time to ask for help. If your relationships are suffering with your loved ones, it's time to ask for help. And you have to ask yourself, how has your loss affected your beliefs about your world? If that loss has affected your beliefs about the world, whether it's a safe place, whether it's a place where people can be trusted, then it may be time to ask and seek for some help as well. And then how do those beliefs affect your emotional state and your functioning? Okay, Libby. Thanks. Okay, so now we're going to talk about how we can support those that we care about. And Libby's going to show a video from Brene Brown because she just explains the idea of empathy in this video better than I ever could. So she's going to go ahead and get that started for us.
Okay. Y'all bear with me. I'll try to do this right.
So what is empathy and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
All right, thanks, Libby. So, I think that illustrates so perfectly what we need to do to be able to be supportive of other people. And that is to be with people in their feelings, and to try to create connection, even if we may not completely understand what it's like, what somebody else is going through, to be able to listen, be supportive, and just be somebody who is not going to go away and not going to make them try to feel better. And that does require being comfortable with your own feelings. If that is something that you struggle with, you struggle being with people during their difficult feelings, then you have to ask yourself, how comfortable are you with your own grief? And if you're having difficulty with that, then that's something you may need to work on for yourself. And then the last question is how you might be able to encourage others to seek professional help. And one way is to not tiptoe around it, right? We just talk about the importance of mental health and seeking professional help, like we go to the doctor when we have a virus, right, or a cold or whatever the case might be. Then it's not something that's stigma. And then if you've sought help for your own reasons in counseling, to share that, like to say, this was my experience in counseling and it was so helpful. All of those things can really encourage others to seek help. And I'm going to stop there because I think I went over my time. So that we want to have time for questions.
No, you're fine. You're fine, Kristi. And yes, if you've got a question for Kristi, please share it in the chat. Kristi, I would ask you to talk a little bit more about, when you say how comfortable are you with your own grief, I would ask that you talk a little bit about how comfortable is society with grief, because that sense of getting over it or getting closure, to me, in my own grief, it feels like pressure from the external world to not be sad anymore because people don't want to be around somebody who's sad, or people don't want to hear about something that makes them uncomfortable. So talk a little bit about that, please.
So to answer your question, how comfortable is society with grief in general? They're not. I think us as a society, especially in American culture in general, we are not comfortable with grief. And so that's why we say all these things that we think are helpful and are going to make people feel better, like, oh, well, your husband is in a better place now, which is true, right, depending on your spiritual beliefs, but that's not going to help anybody to actually feel better. It doesn't take away the fact that this person is still really hurting. And so all the things, when I in talking with clients who have been experiencing grief, one of the things that comes up most significantly is their frustration with other people and their attempts to help. And other people's attempts to help that aren't really helpful tends to come from the fact that they're not comfortable with grief. They don't know, because they know how big it is and they don't know how to help. So in desperation, they sort of say things that are really not very meaningful, which is why I come back to the importance of just listening, just being there. I'm so sorry that happened to you. It must be so difficult. I can't even imagine what you're going through right now. Those are the things that are affirming and validating that people really need to hear. One of the times I actually said that to one of my friends, she was a new friend, and so we were still getting to know each other. I think I said to her, she wasn't dealing with loss, but something very difficult. She was like, I said, wow, that must have been really hard. That probably really sucks for you. And she was like, it really took her off guard that I just went there with her and acknowledged that this was not something that she was used to hearing from people. But those are the kinds of things that create connection. I have to be vulnerable to feel my own feelings about grief. and to be with somebody else who is vulnerable. And when two people are vulnerable during an interaction, that is the most meaningful and important kind of connection that we can create for people. And one of the most important parts of being able to heal and move on and integrate loss is being able to have a sense of connection through that process.
That's right. You know, Kristi, because from a personal standpoint too, grief is so isolating in and of itself. And so when I'm able to have that one-on-one connection with somebody else, it just helps me feel less alone. And along those lines, and Dr. Blow, please chime in too. Some things not to say or not to do. From my own experience, I can say that especially when you're in that acute phase of grief, it is not helpful for somebody to say, let me know what I can do. The fact is, I am so full up with things that I have to deal with. Just getting out of bed in the morning is about the best I can do. So what's more helpful were the friends who said, I've made some chili for you and your family. I will be bringing it over Saturday. That was great. I didn't have to say, oh yes, please make me dinner. They just said, I'm going to do this and I'm going to bring it here. And instead of, you know, let me know if I can help, let me know what I can do. Cause I can barely, you know, figure out how to brush my teeth in the morning. So, you know, what are some other things that are sort of those do's and don'ts about, you know, what not to say when somebody's really struggling?
Go ahead, Dr. Blow.
Or Kristi, doesn't matter.
Go ahead, Kristi.
So the don'ts definitely include, you know, saying things like it'll get better soon, you're going to be okay, you know, that kind of thing. And then since we understand that everybody has different needs, to be able to ask, you know, what can I do for you today that's going to be helpful? Is it okay if I bring you, you know, some dinner? Is there anybody I can call for you? And you know, and you can, most of us know our really close friends well enough to know when maybe they're saying no, but they really need help. So don't bombard them with that, but maybe ask again the next day if they say no, if you know that there's somebody who typically has trouble asking for help. And like Libby, like you said, so sometimes just bringing it and dropping it off and not needing to stay and visit or anything like that in return is one of the most helpful things that we can do.
Dr. Blow, did you want to add something?
Yes, I think just adding to that, I think they're all great advice and definitely things we've all done. And I think that's what's important about this conversation is that sometimes, and you might say to yourself, wow, that's exactly what I did. And I was trying to be helpful. And that's okay. I think that's the thing is everybody's different. And like Kristi said, really it's taking that individual as much as you can, even though sometimes even that individual during a stressful situation might behave differently. And so being, like I said, I think grace is the word. I know in our house, we use the word grace daily. And so we try to constantly say, you know, you'll misstep. We'll make mistakes through the process. Everybody goes through it differently. Like I said, some people go through it and take longer. I think for me, one of the things that I see oftentimes with family is the timeline. And so really being flexible on how long it takes someone to get back and to find that. I think that's so important. Don't put your own, what you believe to be how grief should be coped with, what you believe that timeline would be, what you believe you would do in that situation differently. And I think Kristi mentioned this, and this is so, so important, is making sure that when you talk to someone in our wanting to console someone, we oftentimes talk about ourselves. And so making sure that you give someone that space and don't do that. And sometimes it's a very, I think, conscious effort every single time. If you might have someone in your life, I know I do, that I speak to often that's dealt with a loss of a child. And so this grief has gone on. And so it's so important to make sure I make a conscious effort every single time I talk to them, because my natural tendency is to give advice. That's what I do every single day. So I just want to fix it. And so I want to give advice. I feel that that topic of making sure you seek professional help is so important. And this is the reason why, because sometimes you might think you're giving the best advice, but you're not. And so it's just important to give yourself that grace. Know you'll misstep, but learn every single time. If you know you do that, make it point to yourself to say, I'm going to go 10 minutes and just ask, open-ended questions and listen. And that's probably what I do every single time I'm on the phone. I just listen. I rarely share because that's what that individual needs. But it takes years sometimes, and every person is different. Other people are looking to you to give them that advice so they can get through that day. So there's no right or wrong. I think with grief, really what I found in medicine is there's no right or wrong to anything. And so it's just about finding that individual and making sure that you try to address their needs. Because I think that's probably what I've learned the most through the years, is that every person you're really, when you're being that supportive ear, it's figuring out what that individual needs. And it'll be different for every single person. And it'll be different even for that individual with different types of griefs that they'll go through throughout their lives. Something you might have done for them in the past might not be where they're at today. And so I think meeting that individual where they're at today.
Well, and one thing I would add is not to forget about them, after the funeral, meaning we all respond really well right when a death or a loss occurs. We go through the societal tradition when it's not COVID of having a funeral and things like that. And then everybody kind of goes about their lives, their daily lives, where whoever is left behind is left with that grief that obviously goes on. And so, 3 months later, I remember after my husband died last year, I think it was 3 or 4 months afterward, I got these beautiful flowers from a good friend who had lost her husband. And she knew, that all those flowers that arrived in that first week were dead and gone, right? And so she sent me this beautiful bouquet. Several months later, I had somebody else who, like, every month sent a card and who had also lost her husband, about with some booklets about grief, and other people who have invited me to do things. And while I may not have been ready at the time, I've said to them, please keep inviting me, because at some point I'm going to be ready. So I would just stress not to forget about that person, even in the years to come. A question that came up in our Q&A, which I think is a great question too, is how might you educate someone who is experiencing grief about the benefits of counseling, particularly if they've had a bad experience with counseling in the past?
That's such an important question. And I just had it this week. I had someone that their family is going through a loss, and they just went on to tell me about this terrible, and it was a terrible experience. And so what I always tell patients, and this comes with all kinds of things and recommendations that we make, it's like if you went to a physician and you didn't have a good outcome, or you went to a store to buy something and someone was rude, or you went to the dentist, and a lot of us have that experience, right? You don't go back. And so, but you still have to, you recognize that we're all individuals, right? Just because we put a uniform on, a white coat, we go to a store and we put on, whatever, we work, there's going to be different personality types. And so in those particular situations, especially when you really see counseling is warranted and is needed, what I would try to do is maybe make a personal recommendation. I know me as a physician, I reach out to the counselor, I let them know about the experience, I make the connection in the hopes, and I try to find somebody that seems to work well in those situations. And that might be the extent of which you have to do it. Because I think sometimes when it's a personal, it's like with a physician, sometimes not all of us are made the same. Just like in every field, you'll have problems. And that's usually the specific family. It's so funny this comes up, but this specific family, that was my conversation with them, is that unfortunately there's individuals, and that person, what I always emphasize is that counselor might have been fantastic with the other hundreds of patients that they've seen in that month, but that was just a bad experience. And that's the grace we talk about, right? Is everybody has a bad day. Everybody has, maybe they just weren't the right fit. And so really emphasizing that you deal with that and you make those decisions on a daily basis, and you continue to go eat at a restaurant, or you continue to go to the store, or you continue to go to all kinds of services. And just because you had a bad experience, you can't judge the whole field by that. And so I think doing that, being able to make a personal recommendation is super important as well.
Yeah, I would definitely agree with Dr. Blow. Personal recommendations can be really helpful. And it is so hard when somebody has a negative experience in therapy, because clients make themselves vulnerable when they come to our office, no matter what. Just stepping into our office, or right now logging into our virtual sessions, is a scary and vulnerable thing to start. And so when they have a difficult experience, I totally understand why it might be, they might be hesitant to continue. But as a therapist, I am not a good fit for every single client. I bring who I am as a person into the therapy room, and I'm not going to have really close relationships with everybody in any aspect of my life, and that is true in the counseling relationship as well. Personal beliefs and all of those things, even though we stay objective in counseling, and we don't bring our personal beliefs into that, when somebody's being genuine in therapy, and personality types don't match, then that's sometimes can be really difficult to develop the rapport that's necessary to make a client feel comfortable and safe in therapy. And so, if it's not a good fit, it's not a good fit, and we try somebody else, and maybe try to get some information. Well, what was it that you felt like, got in the way? What was the barrier during that process? I mean, it could have been something as simple as, I didn't like the color of the room. It was bright red and not, therapeutic. It wasn't calming, or whatever the case might be. But getting some of those details can be helpful in terms of maybe directing them down another path. Sometimes the age of the therapist makes a difference. Somebody wants somebody older or younger, or whatever that case might be. So sorting through some of that can be helpful in the process of encouraging them to try again.
And I would add to that, if you yourself, or if anybody on this webinar has benefited from therapy or counseling and you're comfortable with it, please share that with other people. I feel like I was fortunate, because off and on during my life, I have had a counselor, and prior to my husband's death last year, I had a counselor who had worked with us for several years over some blended family issues. And she has remained a lifesaver for me, because I had that relationship with her. And I am not shy about talking about it, because I feel like sometimes we're still embarrassed to admit that we had to get some professional help, or, it's just not something that's talked about a whole lot, maybe more than in the past. But still, if we could kind of remove the stigma that somehow that's a weakness, or that there's something embarrassing about getting counseling, then I think that would help a lot of people. Kristi is probably too humble to say anything, but the work that they do at Family Counseling Service is really phenomenal. There's a sliding scale, it's affordable. So, we're going to get to the resources slide here in just a minute, but that's certainly one of them. Another question that we have in the chat, though, and this is a great one as well. Can we also briefly discuss how to address guilt? Guilt for not having experienced severe loss like others have, guilt from not seeing family or loved ones during this pandemic. I would say, if you did lose somebody, guilt in perhaps feeling like you didn't handle the death as well, or the dying, if you will, as well as you should have. So whatever the guilt may be, what are some tools to help us resolve that?
The word grace comes to my mind first. We talk about having grace for others, but having grace for yourself, I think, is just as important, if not more important. Putting it into context, and in this context, we were all in a situation that nobody had a baseline for. Like, there was no, handbook on how to respond to any of these things. And every single day, we all made the decisions that we thought were best for us and our families that day. I mean, and the pandemic was really that kind of a situation where we had to make decisions one day at a time. And so to remind yourself that I did the best that I could with the information that was in front of me. And my goodness, we didn't have much information, did we? We really didn't know throughout, especially the early days of the pandemic, which meant as much as we loved and cared about our friends and family, that we really had to take the extra cautious approach to things because we didn't know. And so keeping the distance, not being able to be with our loved ones so that I didn't get sick and then pass it on to others. All of those kinds of things were decisions that we made based on the information that we had in front of us. And it's very, very easy. I totally understand how we go back and we replay all of those things and the what ifs and the shoulda, woulda, couldas. And when you start hearing those things in your own head of the what ifs and I should have, I hope that alarms go off in your own head. That should be a signal to you to be able to say, well, stop. I can't go there. I did the best that I could. Bring yourself back to, the present situation and remind yourself that you made the best decisions, that you could have in the situation. As far as the guilt, if you didn't experience the own grief for yourself or difficulties for yourself, I think that the fact that you're experiencing some guilt over that just shows how big your heart is. First of all, that you really do have empathy for other people, and that is a strength. And so definitely give yourself some credit for that. But sometimes those big hearts mean that, we really have a hard time dealing with other people's, struggles as well. And so in those cases, gratitude, trying to switch to gratitude. It's okay to be grateful that you didn't experience those things. There's absolutely nothing wrong with that. And at the same, you can be grateful at the same time you feel and acknowledge the pain for others. Those two things don't have to cancel each other out. And so trying to acknowledge both of those things can be really important.
That's all really great, Kristi. I mean, such good advice there that I know I'm taking too. One of the other things that I just want to add to the guilt conversation, which I know many of us felt when we weren't visiting loved ones, or if you had a loved one that was sick and you didn't get to see them, parent, grandparents, whatever that was. And so you have guilt about that decision you made to not visit that individual. I can tell you from working at the hospital, this thing was something we'd never seen. When the wave started and you're getting 20 people, and then you get 20 more, and then you get 20 more, and there's nobody leaving on the other side of it. And that wave built up so much. All I can say, because I know that there's been conversations about that guilt that people are feeling about whether they made the right decision, is that at that time, I think what we were all weighing is saying, if you go and visit and you get everybody else sick, and you turn that one death in that family to 7, what that was going to feel like. And so I know that there was comments on the chat and things like that. And so I think sometimes it's so easy now to look back and say, well, these were our numbers. This is what it looked like. Well, I can tell you that in that moment and what those numbers were looking like, and it's still an astronomical number that we're dealing with. But I think that at that time and what it was, and when you made those decisions, it was a constant weighing of not hurting someone else. And so I think that hopefully that brings you some peace when you deal with that, and when you wonder whether that was the right decision. At least for me, from somebody that was in the hospital and was seeing it, it was the right decision, staying still. And unfortunately, so I can, hopefully that helps you with that guilt that you might be feeling. And I can just share with you that when those numbers were climbing and climbing and climbing, it was just, I still tear up. Nurses that are hard nurses that have been working for 30, 40 years, you get a lump in your throat when you think about what that was. And so make sure that when you're talking about it in this, and when you hear friends and family, I have this all the time with this guilt of whether you visited or not, I can tell you it was the right decision. And, you know, you likely saved lives in that moment. And that's the hard part, right? When you know, we talked about this, right, with flattening the curve. We said, if we do it right, everyone's going to go, really? It was nothing. And so that was so hard, because you don't know what that would have been like if you made that visit. So for those of you that are on this call, that are listening, that are feeling guilty about having not visited or not seeing someone, not been there, I can tell you that I wholeheartedly believe that those were the right decisions at the time, because this thing was just ridiculously contagious. And when you got it, you couldn't predict it, or you couldn't predict who was going to do well. And when we lost friends of ours who were in their 30s, is how you saw how deadly this thing was. So hopefully that alleviates some of that guilt that some of us, feel and maybe haven't been able to voice.
Thank you so much, Nelly and Kristi. I'm going to move on to this next slide. Donna Hurley is a friend of mine here at United Way of the Coastal Bend, our Vice President of Community Impact, and I asked her to pull together some of our local resources for counseling. Obviously, you've heard quite a bit about Family Counseling Service, but Donna, do you want to talk briefly about some of these other resources?
Absolutely. Thank you, Libby. And hello to everyone who's on the line. Let me be really clear that this is in no way, shape, or form an all-inclusive list. It would be pages and pages, and I'd probably still be adding to it. But what I had hoped to offer is a variety of options, as has been expressed throughout this from our great panel members. Grief and the experience of it and the sense of loss is a very individual experience. So there's not like one way or one method or one resource that's going to work for all the people all the time. So I tried to look at faith-based, faith-based options. Many people take a great deal of comfort at their spiritual home. So that might be a resource or an initial resource to reach out to whomever the leader or the guide is at your spiritual home. Some people are really comfortable over the phone, for example. They don't want face-to-face. They may, or it's 3 o'clock in the morning. Who you gonna call at 3 o'clock in the morning? So I included a 24-hour telephone option. There are certainly private therapists and counselors in town that don't necessarily focus just on grief, but offer a variety of services. Some of the symptoms that Dr. Blow mentioned that folks have been experiencing, like increased anxiety. I can certainly speak to that one over the last year. Depression, as symptoms of that sense of grief. So if there's a counselor perhaps that you or your family have known in the past, as Libby mentioned, reach out again to see. There are community options, family counseling obviously being a big one. They do excellent work and provide a variety. They do individual and family and group and couples. And that might be important as well. Maybe it's not just for you. Maybe your entire family is having issues and needs to talk and see somebody for some assistance. So that's important as well. So that was the idea. Now, I did want to note that, like so many other things, COVID has changed service delivery models. And what I'm kind of seeing is in some ways we're in the midst as a community of kind of transitioning back to pre-COVID times. But I would really encourage folks to ask that, are these services face-to-face, if that is important to you? Are they offered via telehealth? And telehealth can be a broad term, but any kind of electronic FaceTime or Zoom, such as we're doing now, offerings might work as well. So it's important to ask about any kind of changes that may have occurred due to COVID and kind of how services are being developed, being offered currently. And the point that was raised earlier about a good fit, I think is hugely important. There isn't going to be, like I said, one way or one person that's going to work for all the people. And so don't get discouraged if you reach out and an organization either can't see you, or you meet with someone and it's not a good fit, that's perfectly fine. And it's not a failure on anybody's part. So it's important to kind of keep at it, because the end is worth it. And getting the assistance that you're looking for is worth it. So again, this is not an all-inclusive excuse me, list, but it is meant to be representative of some of the resources that are available here in our community.
Thank you, Donna. I would add, and I appreciate Donna listing the Corpus Christi Christian Fellowship. They actually facilitate locally a program called Grief Share, which I participated in last year and did find it helpful. It's actually a national program that is often conducted through various fellowships, but that may be something that is helpful to some folks. It's like a 10 or 12 week course, and has a workbook to go with it, and it helped give me something to do when I was, just immediately out of that acute phase. So that was helpful. And then I just added these are personal recommendations. I'm not getting any royalty from anybody, but I will tell you that these are a few things that helped me, particularly immediately after my husband died. And for those of you who don't know, then my mother died about 4 months later. But this book, It's Okay That You're Not Okay, I just stumbled upon and bought it on Audible and listened to it on many of those long walks and found it very helpful. A few months later, I was able to read this 7 Choices, which my sister-in-law had sent me, found it helpful. Healing After Loss is actually a daily meditation book that I still use, that some days it hits me perfectly. Other days I think, oh, these people don't know what they're talking about. So I just sort of take what I like and leave the rest. And it has helped me on many mornings. And then my daughter brought to my attention a recent episode on This American Life podcast on May 30th called Good Grief. So if you're into podcasts, that is also was a really nice, just some good experiences there, some good examples of people getting through grief, particularly in this past year. So I can't believe it is almost 11:30 and we timed that just about perfectly. Are there any other questions? I'm not seeing any new questions in the Q&A or in the chat. Or Nelly or Kristi, are there any last minute comments or wrap up comments that you all would like to make?
I would just real quick, Donna made me think about this in terms of, what is the status of how we're operating at Family Counseling Service with telehealth and in-person and so on. We actually had been providing in-person for children 13 and under throughout this whole time, and then have been transitioning slowly in different groups back to in-person. But as of July 1st, in-person therapy will be an option for everyone, if that is something that you prefer. But we will also continue to provide telehealth as an option. For some people, it helps them just to feel more safe for health reasons, and others just really enjoy teletherapy and the convenience of it. So we are going to continue to provide that, and that will be, like I said, open to everyone as of July 1st. And so new clients coming in for intake will have that explained to them as well.
Great, thank you. Nelly, do you think to add?
Thank you so much for having this. Thank you for having the conversation. I'll give one last credit to my mom, and my last advice is talk. Have a conversation, ask, listen, and I think that's the way we move it forward. And so thank you so much for doing that.
Well, and I want to thank too, certainly Kristi and Nelly. What the attendees may not know is that neither one of them charged us for this. This is free out of the goodness of everybody's hearts, just because we all felt like it was a very important conversation to have. And as speaking as somebody who did go through this, is going through this still, as Nelly said, talk about it. Talk, when you know somebody else who's going through grief, listen to what they have to say. Don't be afraid to share your own experience, because it is, I think, through that shared conversation, that shared experience, that we do find some strength to move forward. So thank you all for participating. We're getting lots of thank yous in the chat. We certainly am glad that some of y'all took some time out of your day today. As I mentioned, tell all your friends, because we will have a link available on our website and have this posted, and we will get those slides out to you as well. So thank you all so much. Have a great day. Don't be afraid to get some counseling if you need it. Y'all take care. Thank you.